My name is John Flasher. I'm a clinical product manager here at Advanced Instruments. I oversee the osmolality product line, where our osmometers live, and our microbiology product line, where products like our Inoximat anaerobic jar system live. But today we're going to be talking about the OsmoPRO MAX, which again, I'm so excited about. With that all said, we'll jump right into first the instrument features that you can see on the outside, just to kind of show you what it is and what it's all about. And then we'll take a look at the consumables. So I guess I'll just jump right into it. So playing with the camera angles a little bit here. I mean, at the front, I guess without playing with the camera angles yet, what you can see is the instrument itself. We have a really nice display with some really great software features that we'll dig into later on in the presentation. Below the top part of the housing here, we actually have an onboard scanner where you can scan your reagents, so QC materials, your calibration materials, things like that. Behind the carousel here, you'll see this little dark rectangle in the back. That's where the onboard scanner lives. That will actually scan the samples that are being ran through the carousel, the 20-position carousel, which we have right there. On the side of the instrument, you'll see this little USB port. That is handy for exporting data from the instrument, so results or QC results, or a Levy-Jennings plot. I'll show you how to make one of those in the software later. So that's handy as well. Here you'll see the system fluid. The system fluid is what's used to make sure the fluidic pathway, because this is a flow-through instrument. The system fluid is there to make sure the fluidic pathway stays clean in between tests, in between samples. So that's what that's used for. And then all that system fluid has to go somewhere. So it goes right here in the waste bottle, which lives behind the system fluid. Over here on the side of the instrument, and we're going to switch camera angles again. We'll see how handy I am with this. You'll see these two little black things here, and those are our pump tubing housing. So the peristaltic pump, which actually drives the movement of the fluid through the fluidic pathway, lives within this housing. And there's little tubes that kind of clip into place under this housing that need to be replaced every 500 tests as part of the regular maintenance of the instrument. And we'll get into that very shortly. But that's really, at face value, that's everything you can see of the OsmoPRO MAX. It's a really a great design. It's a relatively small footprint for labs that are short on space. If you're familiar with some of our discontinued models like the A20, much smaller footprint than the A20. The footprint is actually similar to our single sample more manual osmometer, the Osmo One. So you can imagine, where you might be able to find space for this on the bench in your laboratory. So some other things I want to talk about are consumables. So over here on my left, you can see basically a number of different consumables that are kind of sitting on the benchtop by the instrument. This is everything that you would get in your SKC convenience kit. So if you were to purchase the OsmoPRO MAX today, we would offer you, along with it, the purchasing of a convenience kit that would give you everything that you need to get started testing and complete validation and do whatever it is you have to do to get up and running and stay up and running until you need to move forward with purchasing more consumables. So what does that mean? What does it come with? The primary consumable is this MAX 500 kit. Again, we will require on this instrument maintenance every 500 tests, and this is the kit that accommodates that maintenance. In this kit, you get one bottle of system fluid, so the little blue bottle of fluid down there. You get an enzymatic cleaner vial, so this is a pepsin-based enzymatic cleaner that helps cleanse the fluidic pathway on the instrument. And you'll get two of those replacement tubes that, again, clip into place on the side of the instrument there. And I'll show you very briefly what that looks like later on in the demo. What else you're going to get is this OsmoPRO MAX calibration set. So this calibration set comes with 4 levels. Comes with 0, 300 milliosmol, 850 milliosmol, and 2000 milliosmol standards, as well as an ampule opener. So when you're cracking open those glass ampules, if you're familiar with those, you can safely do that without worrying about any cuts or any risk there. It also comes with a linearity set. So the linearity set comes with a 0, a 500, 900, 1500, and 2000 milliosmol standard. And then additionally, we also have these protanol and renol controls. You may be familiar with these if you have some of our other osmometers. Renol is used to mimic urine sample. So it is also takes into accommodation the results that you would expect, or the range of results that you would expect under normal circumstances from a urine sample, so 300 and 800 milliosmol standards. And then for our protanol, similar concept, really captures the range that you might expect in normal circumstances from serum and plasma, so 240, 280, and 320. So that's what we offer from a control linearity, calibration, and maintenance perspective. Something else that we're offering as part of our convenience kits, because it's now a recommendation to clean the instrument daily with an enzymatic cleaner at the end of each day. We're offering these 5 packs of enzymatic cleaner within the kits, and we're actually offering 3. So now this will come with 3 of these, so 15 vials of enzymatic cleaner in total, which will give you a little more than 2 weeks of cleaning after you bring on the instrument. Something else that it comes with are these small sample volume inserts. So what these do is, if you have a short sample, maybe because it's just a tough stick, or you're sharing it among other testing in the laboratory, or maybe a pediatric sample, the instrument does accommodate testing down to 190 microliters. So you can simply just transfer your serum or plasma or urine into one of these small volume inserts and run a 190 microliter sample. But I think the key benefit of the OsmoPRO MAX is that it runs primary sample tubes. Runs almost any primary sample tube, and what I mean about that is the tubes that you would just get from your patient draws, so your red top serum tubes, your SST gel separator tubes, your Starstead tubes, your primary urine tubes. Most tubes it will accommodate on this turntable, so you simply just have to load it on the instrument, hit play, and let it run through the testing protocol, and that's pretty much it. You can walk away, you can go do other things in the laboratory. If you got a stat result to call, or if you're in a smaller laboratory where you're wearing many hats, like I used to not so long ago, and you maybe have to go do a cross-match in blood bank, or do a number of other critical things, and you don't have time to babysit a single sample more manual osmometer, this is a really great solution to free up your hands and free up some time for your techs to get other stuff done, which we know is critical. So that said, I want to take a look at these over here. Another thing that you're going to need for the regular use of the OsmoPRO MAX is this Clinitrol 290. So this is our daily calibration verification reference solution. So this will be run at the beginning of every day at a scheduled time, and I'll show you what that looks like. And you actually can't run any tests unless you run this test at the scheduled time. So we'll get into some more details around that later in the demo as well. Another thing that the instrument comes with is this nifty looking little case over here, and these are actually ampule adapters. So instead of having to manually program or scan in every calibration standard, QC standard, enzymatic cleaner vial manually, you can basically just load one of these adapters into the position that you need to load it to on the turntable. You can crack the top off of your ampule, put it in the adapter, and hit go. And then it will immediately recognize the barcode that's wrapping one of these adapters and know exactly what it's testing and in what position it's testing it at. So super helpful just to make things easier and kind of add to the benefit of the automation that we've put into this instrument. Okay, so that's an overview of some of the consumables that you'll need to be aware of when it comes to using the OsmoPRO MAX. So I think what I'll do now is I'll just dive into, I almost lost my remote. I'll just dive into some of the cool software features that accommodate for more efficiency and just easier use of this platform overall. So let's take a look at what that looks like. So what you're looking at here is your home screen for the OsmoPRO MAX. So on the left, you'll see those 20 positions. Those are meant to represent the turntable positions in your 20 position turntable. And there's different colors and indications that let you know what's happening in that position on the turntable that I'll get into in just a second. In the middle where you see all those dashes where it says milliosmoles per kilogram of water, that's where your result's going to show up when the sample does finally report a result. And then also you're going to have a log of all of the recent samples that are run along the right side where it says position, result, and ID. And you'll see what that looks like when we run a sample in a little bit. So what else is helpful to know about this home screen? This right here, this little green teardrop looking thing, is our counter for the number of tests that we have left before performing the required 500 test maintenance. So as I mentioned before with the Max 500 kit, every 500 tests, you actually have to go in and perform a maintenance where you change the system fluid, change the peristaltic tubing, and perform an enzymatic cleaning. This will actually count down from when that event happens, and that little green teardrop will change to yellow when you're getting a little close, and red when you're very close to needing to perform the 500 test maintenance. This little QC indicator here is green when your QC has been performed and has passed for the day. The number within the little QC indicator represents how many hours you have left before performing QC testing again. So that's that Clinitrol 290 standard that you have to run every 24 hours. And once that counts down to the time that you set, you'll have to run that Clinitrol 290 again before performing any testing for the rest of the day. So that is a gate to performing testing. This indicator here, where it says LAN, is going to be your LIS connectivity indicator. This is a demo instrument. I don't have an LIS here in the demo room in Norwood, so it's not anything. But typically, it's green if it's connected, and if it's not connected, it's red, and there'll actually be a number in there that lets you know the number of results that have reported on the instrument that have not crossed over into your LIS. So that's also a helpful indicator as well. This little orange question mark, we're going to click on that. And this is super helpful because it's just a legend of all of the different indicators that you might see pop up in the regular use of the instrument. So we talked about the colors in the turntable positions and what they mean. Some of these other loading and testing indicators. And really, you can just kind of click through all of these tabs. And if you're ever confused about what means what or what's going on with the instrument, you can get all that information here. This last tab where it says access levels is an indication of, depending on your user profile, what you can actually access, change, or perform on the instrument. So the little gold key is for supervisors only, and the gold and silver keys are for operators and supervisors. So that's just a neat new feature that allows you to pre-program user profiles and user permissions for folks in your laboratory ahead of actually using the instrument. So a great feature there. Okay. So we're going to go ahead and open up this menu, the three little lines there, and see all of these submenus within there that you'll most frequently interact with. So within this, we have calibration, we have results, we have the maintenance kit menu, settings, diagnostic, and controls log. The first thing I want to show you is the results. So we've already run a few samples this morning for our folks out in Europe. I actually canceled that last one to show them what that looked like. But in your result log, you can actually see a log of all of the results that were performed on the instrument over a span of the last 1,000 tests. So we can store up to 1,000 results and 10,000 instrument events within this software. So you really have a leeway of about 1,000 results before you need to consider, okay, am I saving my paper copies that I'm getting with an external printer? Am I backing this up on some hard drive somewhere by exporting the data? Because that's also a feature. You can see this little export button right here that you can use this little USB port on the side of the instrument to export whenever you're ready. All right, going back to camera angle number 2. You can see these results again. Some other nifty features here on the result page. If I select a few results here, a bunch of Clinitrol 290 that I ran earlier on, you can see these 4 different results popping up on the result menu here. You can perform stats. So this little menu pops up when you hit that button, and it says, hey, for these 4 samples that you selected, you've got a mean of 290.5 milliosmoles, a standard deviation of 0.6, and a coefficient of variation of 0.2%. So pretty darn good. Okay, let's take a step back from the result page. Let's take a look at some of the other features on the instrument. So I think another really important feature is the controls log, right? We have a bunch of different controls that we use for several different instruments in the laboratory, and inventory management can sometimes be a bit of a challenge. And I did just want to mention that, whoa, we're a little out of focus there. I did just want to mention that, let's try to get this back. Sorry, folks. There we go. I did just want to mention that even though I'm manually logging into each of these menus where it requires permissions, there is going to be a feature, and I'll show you later on, it's just a button that you hit that allows you to also badge scan your way into the instrument using the external scanner, so you don't have to worry about manually logging in every time. I'm just pretending like I'm a service representative using the service profile and service password to get into each of these menus. So that's what you're going to see me doing here today. But just know that there is a much easier way to get into the instrument than logging in with your username and password every time. Okay, so all that I have logged into this instrument right now is a Clinitrol 290 control. So you can see it gives you the ID, the lot number, expiration date, nominal value, so your C of A value, as well as your range within one standard deviation of the nominal value. So that's all of the information that it shows there. But if I wanted to click on this, if I wanted to see a Levy-Jennings plot of all of the control runs that I've run as part of this lot of Clinitrol 290, you can just hit this little chart button. And then you can see the plot right there. And then based on your standard deviation that you set for the acceptability of results of your control runs, you can actually see which bands correspond with where your results actually lie. So just an example of what you can see there. You can also see a date range that you can pre-program to see, okay, since this date, how have I been performing from a QC perspective? Another cool feature that we have here is an export of your QC data to the advanced QC peer QC program. So it's just an external software, something you might be familiar with from some other vendors that allows you to store and analyze QC data from the instrument and compare to the performance of your peers for those same instruments. There's going to be some functionality that allows you to do that straight from the instrument. So there's no middle steps. I think we got the focus issue figured out. Thanks for that, Jordan. Okay, so another thing you can do from this menu is you can go ahead and manage your inventory. So if I wanted to, let's say, delete this, I could. A little message pops up, says, hey, you sure you want to do this? It's selected as a control. We could just say yes. And then it disappears. So if you want to add a new QC, which is what we're going to do, you would go ahead and remember the onboard scanner lives under this top housing right here. It's looking for something right now. You'd scan your UDI. And then it would populate all of this information that you already saw on that other page. So your ID, lot number, expiration date, your C of A or nominal value, and then your acceptable range within 1SD. You'll hit save, which will go from blue to gray, which means that the record has been saved in your inventory log. You just go to exit and you can see it right there at the top of the list again. So same thing with your calibration standards and any other QC that you want to add to the instrument, like your renal and protonol. All right, so we're going to back out of there and we're going to go into settings. So in settings, you have a bunch of different menus you can choose from. And look, again, they all have those gold and silver keys, which let you know who's allowed to go in and change things around. But you have really general things like your date and time, your hardware options, which is really just settings around like screen dimming and things like that. And then you have more advanced settings that maybe you'll work with your LAS team to coordinate or your IT team, like networking and data management, or even things like probe resistance and alignment that you can work through in the IFU or with the help of your tech support team. But some of the more common menus that you're going to use from the settings menu is first going to be the users. And we've talked a little bit about user permissions. So this user list shows all of the active users for your instrument. For this instrument, it's a demo instrument. We just have admin and service. But if we wanted to add somebody, I mentioned that we have Jordan here manning the chat. We're going to pretend like we hired her in our laboratory because she has an exquisite resume and all of her references checked out. So we're going to go ahead and add Jordan in here. And then put in a generic password, which is ill-advised. And we're going to call her a supervisor because, again, references checked out, great resume. We're going to bring her in to run the show in the chemistry lab. So you can see that Jordan is listed there in the middle in alphabetical order as a supervisor, and it lets you know when her password was last changed as well. Well, Jordan was too good for me, and she actually took a higher paying job in another laboratory. I trusted her. Maybe I shouldn't have, I don't know, but she's actually going to leave the lab. So we're just going to go ahead and delete her off the list. So it's that easy, really easy to manage user profiles. and their permissions within the instrument. Okay, so some other features I want to show you here. I think the most important one is down here, and that's configuration. So I had talked about a couple of things when I was covering the consumable overview. And we talked a little bit too about operator permissions. So within the standard operators of the instrument, this is the menu where you can actually select which activities you're comfortable with a general operator performing. And over here, this is where you can basically pre-program your testing requirements for the instrument. So what does that mean? So you can check things like a user ID or a sample ID to be required for testing on the instrument in general. Or over here on the right of the screen, you can pre-program replicates. So some laboratories, based on the information, the VOC that we collected from labs on what they want in this software for the next generation osmometer, prefer to run osmolality testing in duplicate for each sample. So this software feature gives laboratories the flexibility to pre-program duplicate testing for each sample. So if you wanted to run 2 tests for every sample, you can pre-program that here. If it's outside of a certain range, right now it's set to a 6 milliosmol spread, then you can also pre-program it, checking that little box on the bottom left-hand of the number of replicates per sample area. You can also pre-program it to automatically retest to see if the next test is within the acceptable spread before moving forward with the rest of the tests. And you can do the same thing on the bottom right for the QC as well. So it's a really handy feature for, again, not having to manually go back and do everything outside of just loading the instrument on the turntable and hitting play, just letting it do its thing. Okay. Okay, so there was a question about will it have a feature to not report values if the replicates fail repeatedly? Yes, you will have the control to decide if the results are reported or not. Definitely. So another feature, we talked a little bit about the requirement for a daily Clinitrol 290 run. So as part of that, we put this feature in the software that allows you to schedule the time that you want to run your daily QC. So most folks, I guess most laboratories, right, your techs will come in on first shift in the core lab, and they'll run through and they'll run a litany of quality control on a bunch of different instruments, usually around the same time of day. This gives you the opportunity to schedule the time of day that you want to perform the QC for this, so that each day it will require it at the same time. Once you perform that QC, you're free to test for the next 24 hours. But if you schedule it for 7 a.m., for example, and you come in and try to run a sample at 7:05, the instrument will kindly remind you that you need to run your QC first. So this is also where you can program a number of replicates as well. If you're outside of that time range, but you want to force the QC test anyways, you can hit this button on the screen as well. Okay, next feature. So action for control out of range, this is where you can say, hey, if it's outside of the range I specified, I want it to let the user know, or I don't want them to be able to continue testing at all. So if you're a laboratory that likes to perform, let's say QC every 8 hours, and you don't want to be able to report testing if it's outside of a certain range, then this is the menu where you can set that as well, outside of what we already require for the 24-hour test. And then just some more general features on this tab around providing a reminder for calibration, things like screen dimming, and then when it automatically logs out of a menu. So you're not left in a menu where there's maybe a specific supervisor position that somebody else can gain access to who shouldn't be using it. And then this is where you can program the use of a badge scan to log in the instrument. I told you that you won't have to log in with your username and password every time. This is where you kind of select that option, so you can program that into your user permissions as well. Okay, so I did want to mention for that daily Clinitrol 290 check that you're going to be programming for 7 a.m. Or whatever you want to program it for at the beginning of each day. The reason that's required is because it's actually checking your daily, we'll get back into frame here, your daily Clinitrol 290 performance against a 290 baseline that's established at the time of calibration. So every single day, when you run the test, the instrument is comparing your result to the baseline established. If it's outside of plus or minus 2 milliosmoles and within plus or minus 6 milliosmoles of the baseline Clinitrol 290 result that you established at the time of calibration, the instrument will perform what's called a single point adjustment, which is kind of likened to what you would expect on an instrument like a blood gas analyzer. So if it's outside of that range, it'll automatically re-baseline your 290 result, prompt you to run another 290 sample, and then once that result passes, you're free to continue testing throughout the rest of the day. So this is just a feature that we added as an extra level of assurance to ensure that you could consistently perform testing without any interruptions or without the frequent need to completely recalibrate the instrument when it isn't necessary. So just an added feature that we put in there to make sure that we could accommodate the continuous testing of osmolality. What's that? The daily Clinitrol 290 run is not optional, no. Okay. So moving on. So we talked about the configuration features. We talked about user profiles and some of the other things that you're going to see on this menu. We're going to go ahead and go home and go back to this menu. So we looked at the control log, we looked at the results, and then we looked at the settings. So these ones on the top left and top right, calibration and maintenance kit, are also going to be important to regular use as well. And I'm realizing that you can't see the screen. There we go. So these menu items on the top left and top right, your calibration and maintenance kit, are going to be important for use as well. And what's really great about the OsmoPRO MAX when it comes to calibrating or performing maintenance is that it really walks you through every step of the calibration or maintenance process with a step-by-step, frame-by-frame training video for each part of the calibration or maintenance procedure. So as you can see, the first thing that it's going to prompt you to do is to take your calibration kit that comes with the OsmoPRO MAX and hold the symbol on the back of the box, which is an RFID reader, or which is an RFID tag, up to the RFID reader on the instrument. And then if you look on the right hand of the screen here, it'll actually tell you what you need to do next. So after that, you'll go ahead and hit load, and then you'll see another similar video description on how to load all of your ampule adapters into the turntable, what position to load them into, and how to carry out the rest of your calibration all the way to completion. So we're not going to start that because once you start, you got to go through that whole process. And a similar feature is accommodated by the maintenance kit process. Again, once you start that, you can't stop it. But once you go into that, it does give you a frame-by-frame instruction of how to perform the entire maintenance, 500 test maintenance of the OsmoPRO MAX. And to do that, you're going to do three things. You're going to replace the system fluid, which again is the blue fluid in the front. You're going to empty your waste container. Then you'll replace the peristaltic tubing on the side of the instrument. It's really easy. It's hard to get a good angle on this with the camera angles that we have here in the demo room, but it's really just two short tubes that screw righty-tighty, lefty-loosey onto this tubing connector here. So it's really easy to take them off. There's no jamming anything in there or forcing anything at all. It's just simply screwing it on or unscrewing it off. And it just lives in this housing here on the side of the instrument. Really simple to just kind of load it in there and keep it in there. And then to put it back on, you simply just clip it into place. Easy peasy once you change the tubes. And then when you go ahead and load your enzymatic cleaner, which is the final step of the 500 test maintenance procedure, it will not only clean the instrument, but it will use the aspiration of your enzymatic cleaner to calibrate the peristaltic pump and tubing that you just added to the instrument. So dual purpose. Okay, with that said, I think we've covered all of the key software features of the instrument that accommodate continuous and automated testing of osmolality samples, and we covered all of the different consumables that you'll come into contact with the regular use of the OsmoPRO MAX. So I think all that's left to do now is go ahead and run a sample so we can show you what that looks like. So we'll take a different angle here, and I'm just gonna come across the camera here and grab my sample. So again, The turntable really accommodates most primary sample tubes. So it can be your gel separator tubes, your red top serum tubes, most urine tubes that you'll get for collection as well will go in here. And really the primary requirement for loading a tube is just making sure that that barcode is facing out. So when the turntable does turn through, that little black rectangle in the back where the scanner, onboard scanner lives for the turntable, actually pick up that barcode and know exactly what sample is in what spot so it can continue testing. So we're going to go ahead and pretend that's our patient sample. We're going to hit play. And it's going to go through and scan each spot starting at position 20. And it's going to keep looking for samples in the turntable. There was a question in the chat, is the enzymatic cleaner applied to OsmoPRO? Because the OsmoPRO does not use flow-through technology, because there's no fluidic pathway to accommodate testing on that instrument, it does not. It just requires that the sampler be cleaned regularly. No, the daily QC check is not making adjustments to the calibration. So now that we've run a sample, I'm going to go ahead and show you what it looks like on the screen here. Okay, so as you can see, we pre-programmed the instrument to run duplicate tests for a sample that we put in a single position. So over here on the right hand, you'll see 1-1 and 1-2. That's because both tests are going to be run on position 2. So that's what's on the left side of the dash. And then on the right side of that dash is 1 and 2 for each of the tests it's going to run. The results are going to populate under the results section. And your sample ID is over there on the right. So that's where your accession number would live. So we're going to do a little bit of an imaginary scenario here, but not so imaginary. So for example, if you had a patient come into the emergency room, let's say that your emergency docs have reason to suspect that they either purposefully or accidentally ingested a toxic alcohol, which is bad news. And we're not talking about somebody who went and had too much to drink at the bar. We're talking about ethylene glycol or methanol or isopropanol or something like that. In the laboratory, we really don't have a readily available test to either confirm or deny that a patient has consumed any one of those alcohols I just mentioned. So we really rely on measured osmolality testing to help us rule that out. So most laboratories also can lean on their chemistry analyzer to provide them a BUN result, a glucose result, and a sodium result that they can use to create a calculated osmolality measurement. But what that misses are any other things that could be present in the patient's serum that could elevate the measured osmolality. So when a provider suspects that a patient may have ingested a toxic alcohol, they'll subtract that calculated osmolality from the measured osmolality, and that's called an osmolar gap. And if that's greater than 10, then that provides evidence towards them confirming the fact that the patient likely has ingested a toxic alcohol. So what does that mean? That means it's a stat test that informs a very critical and fast treatment to avoid permanent organ damage or even death. So we're talking about kidney failure or death, right? So this patient would immediately put on drugs to help them digest the ingested toxin. And then they would also be put on dialysis to clear any of the ingested toxin out of their bloodstream. So really critical that we get that result as soon as possible for these providers. So if you're sending that result out, you're talking about paying extra for a courier to come and pick it up and bring it to your sister hospital or a reference lab, and not speaking poorly for our folks we have at the reference laboratories here on the call. What you do is extremely important, but for this stat result, getting those results faster is critical. So if you have something like an Osmo 1 or an OsmoPRO and you have tests running in a batch, you don't really have the ability to prioritize that stat test to run on the instrument right away. What's really cool about the OsmoPRO Max is you can continuously test up to 500 samples consecutively by hitting this button telling it what position you're adding your tube to, loading it and letting it go. And once it completes the test that it's currently running, it will go and scan that next one and add it to the queue. But let's say you get that stat test in from the ED and you need that result right away to inform that critical treatment. You can hit this little stopwatch with the lightning bolt, and that little message on the top will pop up that says select positions. And what you do is you just select a position on the turntable, you'd scan it in, put it in that position, and then let it roll. And what it will do is it will prioritize your stat test over all of the other tests that are waiting in the queue to be tested in your turntable. So a really cool feature on the OsmoPRO MAX. So we've aspirated the sample. We brought it in to the sample chamber. We performed a freezing point depression measurement within the sample chamber, and we got our first result. It came right in at 290, which makes a whole lot of sense because I just put some 290 in a tube off to the side over here to use as my patient sample. So that came in right on the money at 290. And because, again, we pre-programmed those duplicate tests to be run for each sample, it's just going to go right into cleaning, as it typically would following testing a sample. It's going to empty all of that out into the waste container, and then it's going to prime the fluidic pathway for the next test to be performed on that same sample. And that's what it's going to do in between each test as well. So it's going to go ahead and just go right into the next one. Okay. So with that said, we've got about 19 minutes. I know there's a lot of questions that have come through the chat, and I will do my best to answer as many as I can. If we can't get to all of them, then I'll make sure that I respond to each of you accordingly following the presentation here. But thank you so much for hanging tight and asking a bunch of questions. And again, for those of you who have been waiting, thank you for your patience. I know you're going to love this instrument, and I am so excited to get it back out there and get it into your hands. And for those of you who are interested, this is a great instrument, and it's going to make things way easier for you from an osmolality testing perspective. So looking forward to hearing from you as well. Thanks again, everybody, for attending, and hopefully we can talk soon.